A round of applause, everyone. Congratulations to St. Luke's Medical Center, Global City, and PhilHealth.
Thank you very much to our Health Secretary, Secretary Edwin Mercado, DSWD Secretary, Secretary Rex Gatchalian, PhilHealth President and CEO, Beverly Lorraine Ho, St. Luke's Medical Center President and CEO, Dr. Dennis Serrano, SLMC Vice Chairman Attorney Cirilo Noel, Health Equity Research Foundation President and CEO, Dr. Arturo de la Peña, St. Luke's Foundation President and CEO, Dr. Benjo Campomanes, fellow workers in government, ladies and gentlemen, good morning. This very simple ceremony belies the importance of what we mark today, because we mark a partnership that strengthens our shared commitment to ensuring that Filipino patients have easier access to quality and affordable healthcare services and benefits that they all deserve. Getting sick is difficult enough, but for many families, the bigger worry is how to afford the treatment that they need. Walang pinipiling tao ang sakit. Anyone can suddenly face a medical emergency that requires immediate treatment or specialized care. Choosing a private hospital like St. Luke does not necessarily mean that the patient or family can readily afford the cost of treatment. So more often than not, patients turn to these institutions because they offer specialized expertise, advanced equipment, and complex treatments that their medical conditions require. This administration remains committed to making quality healthcare accessible and affordable to more Filipinos. PhilHealth is a key part of that commitment. PhilHealth has been instrumental in protecting families from the financial burdens that come with illness and with treatment. But we in government cannot do this alone. And that is why we welcome the private sector's participation in helping us deliver better health outcomes and provide much needed relief to our patients and their families. Today's signing of the Memorandum of Agreement is an example of that cooperation. The Memorandum of Agreement between PhilHealth and St. Luke's Medical Center Global City reflects a shared commitment to strengthen the implementation of the No Co-Payment Policy and to support the government's universal healthcare agenda. By joining this effort, St. Luke's also sends an important message that quality care in leading private hospitals can be made more accessible to qualified PhilHealth members, and that both government and the private sector have a role in making universal healthcare work. For a patient, this can mean less time worrying about whether treatment is within reach, more time focusing on getting better. For a family, it can mean relief from the fear that one medical emergency can consume their savings or force them to choose between treatment and other basic needs. And for our healthcare system, it means bringing together the strengths of the public and private sectors to better serve more Filipinos. Beyond this partnership, we are also strengthening other government programs that help reduce the financial burden of medical care. Pinabababa natin ang sariling gastos ng pasyente sa pamamagitan ng zero balance billing o ZBB sa mga DOH hospital. Meron din tayong medical assistance to indigent and financial incapacitated patients na ginawa pa nating electronic ang MAIP, gaya ng nasabi ko noong nakaraang sauna. Madali nang makakuha ng tulong sa mga DOH hospital dahil mas kaunti na ang kinakailangan dokumento at maaari na itong gawing online. Pinapalawak din natin ang PhilHealth Yakap upang mailapit sa bawat Pilipino ang libreng konsultasyon, laboratory test at cancer screening. Sa cloud din nito ang mga kinakailangang gamot sa ilalim ng Guaranteed and Accessible Medications for Outpatient Treatment o yung GAMOT program. Kasabay nito, patuloy tayong nagtatayo ng mga bukas center upang mailapit sa mga komunidad ang urgent care, ang outpatient services at iba pang mga serbisyong medikal nang hindi kailangan bumiyahe sa malalayong ospital pa. Malinaw ang ating hangarin. Hindi dapat maging hadlang ang kakulangan sa pera para makakuha ng kinakailangan atensyong medikal. It is a simple and universal belief that we must all uphold. So as we improve how we finance healthcare, we must make sure that our reforms remain compassionate and people-oriented. To PhilHealth and to St. Luke's, thank you for coming together in the service of our people. Continue to ensure that our healthcare systems become more responsive and affordable for Filipino families, especially those who are most in need. Continue removing the financial, geographic, and institutional barriers that keep patients from getting the assistance that they need. We encourage more hospitals across the country to support PhilHealth in advancing universal health care by embracing the No Co-Payment Policy. Together, let us ensure that no Filipino is denied the care that they need only because of financial hardship. Tandaan, ang sistema dapat ang tumutulong sa pasyente. Hindi dapat sila mahirapang sumunod sa mga prosesong lalo lamang nagpapabigat sa kanilang buhay. Thank you all very much. Congratulations for this very, very important day. And we look to the future for this continuing cooperation between St. Luke's, PhilHealth, between the private sector and the public sector in healthcare. Mabuhay kayo at mabuhay ang bagong Pilipinas.
Thank you, Mr. President. And now, may we request the President to kindly grant us a photo opportunity. May we call on stage the heads of the Department of Health, Department of Social Welfare and Development, and PhilHealth. St. Luke's core team, please stand by. Thank you. Please exit to your right. St. Luke's core team, you may now proceed on stage.